Namaskar. In this series on prognosis or the scope of treatment using homeopathy, we have been talking about various diseases. Today we shall talk about DMD or muscular dystrophy. The most common variant is Duchenne Muscular Dystrophy, DMD. This is a genetically oriented disease, especially seen in children, more in boys than in girls. Of course, girls are not fully exempted, and in this genetic condition we find that there is a gradual loss of muscular strength in boys. The muscles of the legs and hands and of the back, they slowly become weak, and the child may have difficulty sitting up, standing, walking, running, and eventually this disease is very progressive and it may affect practically many parts of the body, most of the muscles over few years. My name is Dr. Rajesh Shah. I am a director of Life Force. I am a medically trained homeopath, and we treat cases of all kind of chronic and recurrent diseases from all across the world. Our experience in the treatment of muscular dystrophy is based on around 50 to 60 documented cases of DMD over last 4 decades. In my view and experience, homeopathy has definitely a role to play to control the disease progression of DMD. We have seen improvement in many cases of DMD or muscular dystrophy using homeopathy. However, we have not seen that each and every case of DMD will show results. Some cases are resistant due to inherent causes and we may not be able to help. However, we have seen that around 40 to 50% of the cases, they show some improvement over time. We may not be able to cure this disease, so one should not expect a complete recovery. However, since the disease is progressive, if we can slow down the disease progression and if we could bring some recovery of the symptoms, if we could bring some strength in the muscles, and if we can make the life of a child better, then also it will be an achievement. So homeopathy is definitely recommended for the practically all the cases of DMD. Periodic blood test of CPK is also a very important parameter to see what improvement is homeopathy giving in these cases. So every 6 months we usually repeat the blood test of CPK to see the changes. Homeopathy has to be given along with any other conventional treatment if indicated and given by a neurologist. Both the treatments can go hand in hand very safely, and of course some amount of physiotherapy is also very important for the treatment of DMD or muscular dystrophy. What is the duration of treatment? Well, this being a progressive disease, one may have to take medicine for a very long time. I would say maybe 3 to 5 years or longer, depending on what response we get. If there is good response, then patient may have to take medicine for life also to keep the disease under control, and that itself is the target for the treatment. Homeopathy is absolutely safe even for children if they have to take the medicine for longer period. So that is not a point of worry at all. And homeopathy and conventional medicine are required to be integrated in many chronic diseases. DMD or muscular dystrophy is one of the examples. I hope this video will help patients, the parents, doctors as well as the medical students to understand the role of homeopathy for the cases of muscular dystrophy. Thank you very much.